let's go through the basics of an electrocardiogram, or EKG. As always, like and subscribe if you like our content. We appreciate the support. An EKG consists of 12 leads. The limb leads include lead 1, 2, 3, AVL, AVR, and AVF. The precordial leads include V1 through V6. An entire EKG or ECG strip is 10 seconds. Each small box on the grid is equivalent to 0.04 seconds. Each large box on the grid consists of 5 small boxes, meaning each large box has a value of 0.2 seconds. A small box is also 1 millimeter, so a large box is 5 millimeters. The normal structure of an EKG includes a P wave, which denotes atrial depolarization, a QRS complex, which denotes ventricular depolarization, and a T wave, which denotes ventricular repolarization. The important intervals to know are the PR interval, QRS interval, QT interval, and RR interval. The QT interval encompasses the beginning of the QRS complex and ends at the end of the T wave. A quick way to determine if the QT interval is prolonged is to see where the T wave ends. If the T wave ends past halfway between the RR interval, QT is prolonged. Changes in heart rate require the use of corrected QT or QTC. QTC is prolonged in males if the duration is above 450 milliseconds, and is prolonged in females if the duration is over 470 milliseconds. What are some causes of prolonged QTC? They could be medication side effects or electrolyte abnormalities such as hypocalcemia, hypokalemia, and hypomagnesemia. Now, what is the approach to reading an EKG? The 3 main categories that should first be approached are rate, rhythm, and axis. Now, how do we determine the rate? The rate is determined by looking at the distance between 2 consecutive RR waves. This RR interval should be constant to have a regular rate. A quick way to determine rate is to take 300 and divide it by the number of large boxes. So 300 corresponds to 1 box, or 300 beats per minute, the rate. 150 would be 2 boxes. 100 would be 3 boxes. 75 would be 4 boxes. And 60 would be 5 boxes, and etc., etc. You could also memorize the values per box. An alternative method, if the RR rate is difficult to determine, or perhaps there's an irregular rate, is to count the number of QRS complexes and multiply by 6. Because the entire EKG is 10 seconds in length, the number of QRS complexes times 6 in 10 seconds gives the value in minutes. Determining rhythm requires understanding and determining if a P wave precedes every QRS complex. This would give you a sinus rhythm. Determining axis requires an understanding of the placement of the standard limb leads and what net positive and net negative mean to the impulses in the heart. This means that the electrical impulses have a downward deflection to the apex on the bottom left of the heart. If the heart has left axis deviation, then the impulse will focus to between -30 and -90. A quick way to determine the axis is to look at leads 1 and AVF. If lead 1 is net positive and AVF is net positive, then the axis of the heart falls within the normal range. And those are the basics of reading EKGs. Reading EKGs require practice, patience, and a system. If we start every EKG by looking at the rate, rhythm, and determining the axis, this is a very good start. Now, On our next video, we're going to go over some of the details and some of the more complex scenarios in reading EKGs. Thanks for watching. We'll see you next time.